Hi everyone, this is Audice. I have got a lot of questions on what are the type of disorders that we have. So today's video is going to be highlighting more on the personality disorders. Keep in mind, what I'm going to discuss is type of abnormal psychology, and in abnormal psychology they define that we potentially can have many types of disorders. Some of them could be childhood disorders. The other one that's common, it could be eating disorders, also sleeping disorders, and then personality disorders. Because there's so many in each segment, I am going to make this video on how are the disorders diagnosed, what they are, the clusters, and I don't want to make it too boring. I'm just going to focus on the personality disorders for this episode, but I'm not going to go through every single one. I will do one every week on each one later on, but today is going to be just more of an overview, what they are, how are they diagnosed, are they good, are they bad, what are type of treatments available, what is the good and bad of the diagnostics. So stay tuned. So let us begin with the fact that American Psychiatric Association, it's the organization that publishes a book or a manual. This manual in short is called DSM, or the Diagnostic and Statistical Manual of Mental Disorders. This is the one that we use in North America and probably most of the world. However, that's not the only manual most psychiatrists and clinicians use to evaluate or diagnose a client. There's also the World Health Organization, which publishes their own diagnostic system, which is called the International Classification of Diseases, or known as ICD. Now, both books are available for clinicians and as well as doctors, and it provides them the criteria for marking or making a diagnostic. What is a diagnosis or diagnostic? Pretty much it refers to the identification of the disorder on the basis of its characteristic symptoms. So what generally happens is that if you feel that you may have a symptom, you would obviously make an appointment with a professional, and you would meet one-on-one, and they would use a template or a manual that is already pre-printed or preset by the DSM, and they go through a lot of questions. It's a kind of a checklist, and then in the end they tally out based on the answers that you have given them, and they will give you a diagnostics. Now keep in mind, there are obviously limitations and problems with this system in terms of its reliability, validity, and it kind of has a potential of harmful effect of its labels. So what I personally always recommend is, if you suspect that maybe the diagnostics is wrong, go get a second opinion. Go talk to 3 or 4 different doctors, have different diagnostics, just to make sure, because you may be diagnosed as you are depressed, but it doesn't necessarily mean you are clinically depressed. It could be you're just going through a depressive period. So having a second opinion, a third opinion, fourth opinion, it's very good. Keep in mind, that's not the only way that we, or not me, the psychiatrists or the doctors can confirm if you have a disorder. There are also blood tests, CT scans, MFRIs. There's a lot of other ways to validate whether you have a condition or not. Nonetheless, the DSM, now we are on version 5. They update it almost every 5 years. And the DSM is done throughout the world by asking different psychiatrists, different doctors, the whole health community from different countries come together, and they put in their input and gets verified again and again and tested before they can update the manual with whatever's coming up, whatever new diseases that we have, what are new medical conditions that we have, what are some of the disorders that they can take out or combine. So at the moment, we are in the 5th version. And we have, I would say, about 200 specific diagnostic categories. And when it comes to personality disorders, it's very complicated to go through it, but there are 18 primary headings that they use. And they also have them organized in a cluster base. A cluster meaning cluster A, cluster B, or cluster C. And as you can see, there are a lot of overlaps sometimes, and sometimes you may be between A and B or B and C. So that's what I was saying, is that you need to kind of get diagnosed more than once with different doctors just to make sure, because sometimes there is bias in the evaluation. Sometimes there may be just you're having a bad day and you went to the doctor to get diagnosed on that bad day. Generally, that's not always how you feel, because there's a lot of emotional questions in there. However, if we go through the three main clusters, you will notice that they kind of group them by, for instance, whether you're considered odd or odd behavior. That's one type of a cluster. The other cluster is the personality disorders are kind of more dramatic or emotional, or you may have kind of erratic behavior. And there's another type of clusters that kind of are more towards if you're anxious or you have a lot of fear. And as you can see, some of them are considered very high, some of them could be considered moderate, some of them could be considered extremely, extremely high. Keep in mind, just my personal opinion, we all have all of these. We all have all these emotions. What is considered too much or too little? It could be just what the culture expects you to have, what is considered normal in that culture. It could be sometimes what is accepted as type of a behavior in that specific culture. That's why I always say, get a second opinion, because it could be that you are considered odd because you don't confirm, you do not follow the rules, or you are not following the cult or the beliefs in that culture. That does not necessarily mean you are sick or you have a mental disorder. However, if you are kind of acting a little bit unnormal compared to anywhere in the world, if you see things that are completely unreal, whether you live whatever part of the world, that's where the diagnostics comes in. Whether you go to any kind of doctor, it doesn't matter what part of the world or what different culture you're from, they will still label you, or they will still diagnose you as maybe you do have delusions or hallucinations. Keep in mind, it doesn't matter what label we put on it. What matters in the end is that you do not have to suffer by yourself. You always get the help you need if you put your mind into it. The moment you say, I acknowledge I have a disorder and I want to be helped. I want to be helped and I'm willing to help myself. That's 90% of the treatment, because the moment you acknowledge that you do have a problem that is, and you're not comfortable with it and is affecting you differently and is affecting you negatively, and you put in the work and the effort, you're not going to be left alone. We will help you. Coaching, guidance, counseling, psychotherapy is there. You don't even need to come in if it's maybe not too severe. You can do it on your own by following certain journaling that you could do, or do self-help. And what matters is that you do the work, not us, because what we do is 20% of the treatment. What you do is the 80%. But in the end, you can always triumph.